What if you never reach the maximum dose of your medication? Is that a problem? Let's break it down. Hi, I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based, fact-based answers to your questions, you're in the right place. Okay, one question I get is, what if I never reach the maximum dose? What happens then? So let's talk about that. First of all, do you need to? Now, I've said it before, but it bears repeating that these medications are dose dependent. And when I say these medications, I'm talking about any of the weight medications, but particularly the GLP-1 medications. This also applies to the oral medications, but they are dose dependent, meaning that you will get a greater effect traditionally the higher up you go. So my goal is really for all my patients to get them to the highest dose because that's where they're going to get the best maximum effect. Now, if you can't get up to that, is that a problem? Well, it depends. What's the reason why? Now, there are some people that they actually don't need to. They lost all the weight on Zepbound 2.5 or 5. Maybe they lost more weight than they intended to. That really does happen. And not a lot, but it really does happen. And so those people, it's not a problem if they don't go to the maximum dose. And in fact, that would probably be very unsafe for them because their BMI would be too low. It would not be where we wanted it to be. So for those people, it's not a problem at all. Just stay on the highest dose that gives you the results that you and your physician are looking for. However, for some people, it is a problem because it's the side effects that are limiting how far up they can go. So maybe the goal really is 20% or more total body weight loss, but they can only get halfway because of the side effects. This is often a time where I'll see if a medium dose for 3 months, 6 months is enough, and if we can advance a little bit further, because sometimes it just takes people a lot longer to adjust. But for those people, if they couldn't get to the maximum dose, but it was side effects, and you've tried everything, you've been really patient, you've done all that you can do, you just reached the end of the road where you can tolerate, and then you want to have a conversation with your doctor if you're still looking for additional weight loss. But what are other medications you can add? What are the lifestyle changes you can make? What else can you do that doesn't involve increasing this medication? And then for those people who really lost all the weight that they needed to on a lower dose, they just have a lot of buffer room. So if something happens, maybe they start another medication that is more weight promoting, they have a lot more room to go up on that if they need to. So is it a problem if you don't get to the maximum dose? It really depends on why you couldn't get there. So thank you so much for that question. If you have questions afterwards, please leave them on this video or in another video and I will add them to the list. If you want to work with me directly, if you're on a GLP-1 and you're feeling, my food could be in a different place than where it is now, I'd like it to be a little different, or you'd like your exercise routine to be more consistent, you feel like you're leaving results on the table with your GLP-1 medication, you are not alone. This is why I work with people as a life coach to help them with the non-medical aspects of their weight loss, to help you get your money's worth, get all the results that you can. So if you want more info about that, I will leave all that down below. If you're not subscribed to this channel, subscribe because it's the place for medically based answers to your weight questions. Thank you so much for watching and please be well.